Hi, welcome to another skills video for Foundations of Health Medical Academy. Today we're going to be learning oral care. The importance of oral care is to decrease the risk of infection and to also improve the taste of food and also for the patient's dignity. So that way, if they have good oral hygiene and their breath doesn't have foul odor, they feel a lot better about themselves. So also a patient who has a PEG tube, it's very vital that you do oral care on them at least once every shift because their mouth naturally stays closed for the entire time. Most people are always hydrating or eating something, so your mouth is always moistened. It's always self-cleaning. But for patients who are not receiving anything by mouth, which is called NPO, that is nothing by mouth. Most people get it confused on a test and answer nothing per oral. Nothing per oral is not the correct answer. NPO stands for nothing by mouth. So anytime you see that abbreviation, that person can have absolutely nothing to eat. And so in that case, those people have a tube inserted into their stomach. And so their mouth usually will be dry because they're not drinking and they're not eating, which creates foul odor, which creates bacteria. And since that passage is the same passage to your lungs, those patients frequently get pneumonia. So it's very important to keep them clean every shift. Also, when you're doing oral care, you're going to need a barrier, you're going to need an emesis basin, you're going to need a toothbrush and toothpaste. You're also going to need a cup of water to rinse their mouth and allow them something to spit in. Again, since you're going to be dealing with oral and bodily fluids, you have to put gloves on to protect yourself at all times. So we are going to begin this skill. May I come in? I'm Mrs. Smith. My name is Wileen. I'm your CNA for today, and I'm going to be performing oral care. Is that okay? Yes. May I check your band? Okay, Mrs. Smith. I'm going to close your curtain for privacy, wash my hands, get my supplies, and I'll be back. Now that I've washed my hands and gathered my supplies, I'm back. Okay, Mrs. Smith, I'm back. I'm going to put Mrs. Smith in a Fowler's position. Fowler's position is sitting the patient straight up. Anytime a patient is getting any fluids in their mouth or food, you never want to allow them to lay flat. That increases the risk for choking, especially if that person is supposed to have nothing by mouth. Most likely they have some paralysis on the inside as well. So remember, if you're paralyzed on the outside, you may be paralyzed or have some paralysis on some organs on the inside, which is your throat. So if they cannot swallow, you never want to give them anything. And I know sometimes it's hard because they may cry. People always want to eat, but you could really harm a patient, which could even lead to death. Putting fluids in someone's mouth that has paralysis can essentially drown them just by giving them something to drink. So do not take that chance. If they're NPO, NPO means NPO, nothing by mouth. So the first thing I'm going to do is put Mrs. Smith in Fowler's position, which is sitting straight up in a proper position to put fluids in her mouth to prevent her from aspirating. Mrs. Smith, I'm going to put your head up, okay? And remember, always tell your patient what you're doing, which is part of indirect care. Okay. Now I'm going to put on my gloves. I'm also going to put a towel across Mrs. Smith's chest to keep her from possibly getting her clothing wet. I'm going to put my barrier down. I'm going to put out her emesis basin And this naturally shows you which part goes closer to the mouth, and that's where the curve is. You're gonna put that directly here so they can spit out. That goes here. Curved point goes to the face. So I'm gonna put that on my barrier. Of course, I wouldn't put it on my face. I'm gonna put some toothpaste on my brush and put my toothpaste back in the drawer because I won't need that again. And I'll put this on my barrier. Okay, Mrs. Smith, I'm gonna put a towel on your chest, okay? To keep you from getting wet. And you can open this directly up across from her chest. And then if there's some fluid that leaks, you can take the bottom corner and tap her mouth. Okay? So with that cup of water I came with, I'm gonna kind of gargle her mouth to get it moistened up and ready to be clean. Okay, Mrs. Smith, I'm gonna give you some water. I want you to gargle and spit. Rinse, please. Spit, please. Okay? Now I'm going to take the toothbrush and I'm going to wash or brush your teeth as I normally would myself in a circular motion. So I'm going to brush the front, and that's going to be top and bottom, the sides in a circular motion, top and bottom, this side in a circular motion. Ms. Smith, can you open your mouth, please? And in this side, I'm gonna open and brush the bases, which are the flat part of your teeth. So I'm gonna brush the bottom, front, and side. And then I'm gonna brush the top, front, and side. And then I'm gonna ask Mrs. Smith, or whatever your patient's name is, to stick out their tongue. So just kind of brush their tongue off. And you're only gonna do that about 5 times. Ms. Smith, can you stick out your tongue, please? And I'm gonna go directly up and down. 1, 2, 3, 4, 5. Okay, Mrs. Smith, can you rinse, please? Curved part towards the face. Spit, please. And you're gonna do that twice. Rinse, please. Spit, please. Are you okay? Okay. I'm gonna pat her mouth dry. I'm gonna roll my towel up, put it in my bag that I already had ready at the end of the bed, and I'm gonna put Mrs. Smith's head down since I'm all done with her skill. Mrs. Smith, I'm gonna put your head back down, okay? Are you okay, Mrs. Smith? All right, just fix your sheet. All right, so now I'm gonna take my barrier, my toothpaste and cup, and also my soiled linen and go to the bathroom. Okay, I have made it to the bathroom. So I'm gonna take my cup and throw that away. I'm gonna take my barrier and throw that away. Soiled linen goes in the soiled linen basket. And now I just have these 2 items to clean. So the first thing I'm gonna do is turn my water on. Second thing I'm gonna do is put a barrier down. And I'm going to rinse off my brush. Rinse, rinse, rinse like you would normally rinse your brush off at home. And then I would take a napkin and roll my brush into it. Gotta ensure the part that goes in the mouth is nice and clean, and I put it on my clean barrier. Now I'm gonna grab this basin, hold it with a napkin, and I'm gonna rinse. Remember, nothing gets poured in the sink. You pour it in the toilet. Rinse 2 times, rinse 3 times. Now I'm gonna take a napkin to dry the inside. Throw that away. Take another napkin to dry the outside. I will hold this with a new napkin now, since the previous one touched the dirty part. I'm gonna turn off my water. I can now pick up my glove, my toothbrush, and put it in the clean basin. And throw away my barrier. And now I'm going to take this to open up my drawer since my hands have possibly come into contact with spit or sputum. I'm back. Okay, so I have my basin, my emesis basin, and my toothbrush in here, and also this to open the drawer. So I'm gonna open my drawer with the napkin, place my basin and toothbrush in there. I still have the 2 napkins. Now I'm going to discard these, take my gloves off, and wash my hands. Anytime you take off your gloves, you need to wash your hands. I'm back. Okay, Mrs. Smith, are you okay? Do you need anything else? Okay, well, here's your call light. If you need anything, call me. I'm gonna put your bed down. I'm gonna open your privacy curtain, take my supplies, wash my hands, and document, and my skill is done. That's it. Until next time.